What are uterine fibroids? Uterine fibroids are lumps that develop in the womb. Fibroids can grow anywhere in the womb, which is also known as the uterus. They vary in size considerably. Some can be the size of a pea, whereas others can be the size of a melon. Intramural fibroids are the most common type, and they develop in the muscle wall of the womb. Subserosal fibroids develop outside the wall of the uterus into the pelvis and can become very large. Submucosal fibroids develop in the muscle layer beneath the inner lining of the womb and grow into the middle of the womb. In some cases, fibroids are attached to the womb with a narrow stalk of tissue. These are known as pedunculated fibroids. How common are fibroids? Uterine fibroids are common, with around 40 in every 100 women developing them at some time during their reproductive years. They most often occur in women aged from 30 to 50 years old, but can be seen in women younger and older. What causes fibroids? The exact cause is not known, but they are linked to a hormone called estrogen. Hormones are chemical messengers made by the body, which help different parts of the body talk to each other. Estrogen, for example, helps to regulate women's monthly periods. Uterine fibroids tend to increase in size when estrogen levels are high, such as during pregnancy. They also increase in size with advancing age and decrease after the menopause. Menopause is the time when a woman's monthly periods stop, usually around the age of 50. Uterine fibroids are more common in women of African and Caribbean origin, with around 55 in every 100 developing them. Uterine fibroids also occur more often in heavier women, as they tend to have higher estrogen levels than lighter women. What are the symptoms of uterine fibroids? Around 1 in 3 women with fibroids experience symptoms. The most common symptom is heavy periods. 70% of women with fibroids will suffer from heavy menstrual bleeding. Other symptoms include bloating, swelling of the lower tummy, miscarriage or premature birth, problems getting pregnant, constipation, frequent urination, pain, pelvic or abdominal or during sex, and pain during periods. Many women who have uterine fibroids experience no symptoms. How are fibroids diagnosed? Your doctor will ask you questions about your current symptoms and past health. They will then perform an examination of your abdomen and an internal vaginal examination. You may receive a blood test and be referred for an ultrasound scan. You may be prescribed medication by your doctor or referred to see a specialist. What should you do? Even just the thought of discussing intimate matters with a complete stranger is enough to make most of us blush. So it's understandable so many suffer in silence when it comes to fibroids. One survey published in the Journal of Women's Health found women can delay seeing a doctor for several years. If you think you might have fibroids, it's definitely worth speaking to your doctor. Not only is it important to rule out other conditions, any change in your periods, bladder or bowel habits should always be investigated. Fibroids have never been more treatable. Don't suffer in silence.